syndrome is a rare congenital brain malformation involving the cerebellum and the fluid-filled spaces around it, which occurs during embryogenesis. Approximately 70 to 90% of patients have hydrocephalus, an abnormal accumulation of the cerebrospinal fluid within the cavities called ventricles inside the brain. The characteristics of this syndrome are an enlargement of the fourth ventricle, a partial or complex absence of the cerebellovermis, and cyst formation near the internal base of the skull. An increase in the size of the fluid spaces surrounding the brain, as well as an increase in pressure, may also be present. Distinguishing physical characteristics include a large head circumference, bulging at the base of the skull, problems with the control of the face and neck muscles, abnormal breathing patterns, and malformations of the heart, face, fingers, and toes. The degree of developmental delay appears to be related to the level of control of hydrocephalus. Difficulty with balance, spasticity, and poor fine motor control are common symptoms, as well as signs of cerebellar dysfunction such as unsteady muscle coordination or jerky movements of the eyes may occur. Seizures occur in 15 to 30% of patients. The incidence of Dandy-Walker syndrome is one case per 25,000 to 35,000 live births. Dandy-Walker syndrome accounts for approximately 1 to 4% of hydrocephalus cases. It occurs more frequently in females than males. The ratio is 1 to 3. Dandy-Walker syndrome is best diagnosed with the help of ultrasonography and MRI. The prognosis is difficult to formulate, and it is only moderately favorable even when hydrocephalus is treated early and correctly. Longevity depends on the severity of the associated malformations. The cause of Dandy-Walker syndrome is not known, and it is inherited. Genetic counseling is critical to estimate the risk of reoccurrence in families. Dandy-Walker syndrome have been noted and an increase in frequency of associated congenital heart disease, cleft palate, and neural tube defects appear to exist. Treatment consists of treating associated problems, if needed. A shunt to drain off excess fluid may be placed inside the skull to reduce intracranial pressure and help control swelling. Hearing or visual difficulties, central nervous system abnormalities are associated with poor intellectual development, as well as difficulty with gross and fine motor control. Patients should have a hearing and vision examination frequently as recommended by their physician. Developmental interventionist, occupational therapist, physical therapist, and speech and language pathologists can begin working with infants as soon as they are diagnosed. Resources for teachers include the websites for Guardian of Hydrocephalus Research Foundation, National Hydrocephalus Foundation, National Organization for Rare Diseases, March of Dimes Birth Defects Foundation, and Hydrocephalus Association.